Hi, patients, subscribers, and visionaries. For those of you that's new to my channel, my name is Jan van Zyl, and today we will be quickly just giving you a bit of an overview of what we do in the practice and what's going on here at JJ van Zyl Optometrists. So the last year, 18 months has been quite a journey for me, right from waking up with retinal detachment and a couple of operations later, to starting a YouTube channel and actually finding it very strange and satisfying, but also quite challenging, all in one literally, just sentence. So yes, for those of you that's new to my channel, we try and be very practical in our practice. And thank you for those patients that actually come back to the practice and compliment me on some of the work which I do for them. So in the future now, we'll be trying and actually incorporating a little bit more of our clinical cases, showing you what we do in the practice and actually how we do it. Now, that's important because when it comes to your vision is normally the thing that lasts the longest if you look after it. And what I tell my patients is that, if you want to see if somebody is dead, are you going to scream in their ear, or are you actually going to shine a light in their eyes? Now, your eyes is directly linked to your brain, and it's the only sense that is distance independent. In our practice, we focus a lot on binocular vision, because binocular vision is something which, again, I discovered last year. You don't think about it until you have problems that day. And that specific day after my operation, I was basically blind for about 6 months. I couldn't drive. I had a fall. I had no depth perception. So if you are one of those patients that is struggling with 3D movies, you might find that people say you're clumsy, you are unstable. You might have actually a low-grade binocular vision problem. And in today's video, we will also give you some links in our comment section where you can actually go and have a look at my video on binocular vision, how to actually check it for you yourself. And this is the whole idea of my channel, is to try and do things that you can actually try and figure out what's going on with your eyes and your body and your vision at home. So we are focused on being very practical, a solution-driven practice, and also trying to assist our patients and our subscribers and our visionaries what to do today so that you can actually have a better life tomorrow. And one of the most important things I always come back to is just having a good diet and just making sure that you actually look at your nutrition levels. When it comes to your eyes specifically, it is important to do the more natural things with your vision as well. So for any of those patients that might have a binocular vision problem, this video is going to be for you, and we will show you some of our patients which actually has a postural problem, which have a squinty eyes, and you can actually have a look at that, and we will explain that to you in more detail. So we have a very practical, hands-on approach, and it's important for you to realize that also every single case is different. So what works for one person doesn't always work for the next patient. But there's always basically a guideline, a way to try and think about solving the problem. And when it comes to binocular vision, we're always looking for where the two eyes would work naturally together. So have a look at the following patients and examples and think about how it applies to your own specific case. And we will be doing some patients whose eyes drift, and of course some patients whose eyes cross over. Right, now let's look at the following patient. Now, this person came to me a couple of years ago, and his eye was literally, his left eye was on the corner. Now, part of his work is to actually drive a public vehicle, and he had no or very, very limited depth perception, which obviously, from a cosmetic point of view, but also a functional point of view, was not what he wanted. Now, because the vision for distance was reasonably good on the other eye, there was very little done to actually get him to see binocular at all. So it's taken a couple of years, and you'll see that the moment he doesn't have his glasses on, or if he doesn't do his eye exercises, that left eye starts to drift again. So he's got what we call a low-grade esotropia with a large esophoria. So he's got some type of vision today, as long as he wears his glasses. Now, when we look at glasses and we look at prisms, we normally try and split them. So he's got a vertical component in as well in his prescription, and his total prism prescription is 10 prism base in and 4 prisms base up. Now, what we normally do, we actually split the prisms so that we can have the weights in the two lenses very similar. And I will show you some pictures of how his glasses look. Now, unfortunately, as I said, the key is always to wear your prism glasses. If they are done right, you should see very well with them in literally 15 to 20 minutes once you've got them on. It might take a little bit longer to adapt to them, simply because, as I tell my patients, is that your brain has become very good at seeing bad. And now we want to actually teach you to become good at seeing good again. The problem is very often is that the moment some patients actually have a binocular vision problem, the brain instantly switches off the eye that deviates. And this is one of the reasons why I do not like exercises like the pencil push-ups, which very often is advised for convergence insufficiency, simply because as a patient, you do not know when your two eyes are still looking at the pencil. Now, the same thing applies to this person. So one of the exercises which he has to do every single day is simply because the left eye is drifting out. He needs to literally just look straight ahead and look towards the right, so that the left eye's muscle can actually just become a little bit stronger. Now, at one stage, he did that quite often, and things were looking pretty good. But then, of course, as you know, life happens. Now, this is a typical patient we see in our practice that's got binocular vision problems. Now, we often get asked by our contact lens patients is, what happens if I have a binocular vision disorder, or maybe I cannot converge, or I have poor convergence? What do I do then? Can I actually get prisms in contact lenses? Now, unfortunately, the short answer is no. We cannot do prisms in contact lenses for you. Now, if you have a look at this patient, you will see that she can converge. But after doing just a couple of sky nose exercises, where you look up and you look down, you'll notice that her eyes actually start to drift. Now, this is typically a myopic patient's problem. So if you are short-sighted and you don't wear your glasses enough, you might find that you do actually develop a convergence problem. You then have to do your eye exercises, because if you want to continue wearing contact lenses, we cannot actually prescribe prisms in your contact lenses. And what we often do then is we ask you to actually wear your glasses, which then has prisms in, a little bit more often, and to sustain and do your eye exercises. I cannot emphasize enough that doing eye exercises is literally like brain training. There's a lot of areas in your mind that actually gets activated by eye exercises. And if you do my eye exercise routine, the 6 eye exercises, you will find that this not only targets all your external eye muscles, but also those internal eye muscles as well.